I'm Shannon with Hive, a hub of positive sexual and reproductive health. It's September 2015. We're at San Francisco General Hospital, and I'm here with...
I'm Dr. Stephen Mansell. I am a postdoc at UC Berkeley, and I'm here to talk about male fertility.
Awesome, and tell me about your background. How did you get into male fertility?
So I did my PhD in reproductive biology at Dundee in Scotland, where I was looking at male factor infertility, in particular looking at how sperm cells move and how we can look at the electrical activity of the sperm cell and how we can correlate that to sperm motility.
Awesome, because I have questions for you.
Good.
Yes, so male fertility, meaning what's the likelihood that a man can get a woman or an egg if he's having a surrogate or a partner pregnant? So have a child of his own sperm. Is that correct?
That's a pretty big question to ask. I mean, once again, it does depend on the fertility of the patient in question. Actually, don't know.
So when we look at what's the likelihood that a man or that a couple can get pregnant, and I'm thinking primarily right now of a male-female couple, 50% of the time when they can't get pregnant, it's something due to what is called male factor infertility. And so, what do we know about male factor infertility?
We actually know very little about male factor infertility. We don't actually have a root common cause for what male factor infertility is. The majority of cases that we see are idiopathic, meaning that there's no common cause. If sperm concentration is normal, sperm motility is normal. And in those cases, it can be very difficult to find the root cause. One of the potential causes of male infertility is genetic factors. So patients who have cystic fibrosis, they are born with a congenital absence of the tube that carries the sperm from the testes to the opening. And in those cases, men typically have to go through a procedure where they take sperm directly from the testes and then use artificial reproductive technologies. The other very interesting genetic cause is a rare condition called globospermia, where the man will present with normal sperm count, normal sperm motility, but his morphology of the sperm, the way that the sperm looks, is grossly abnormal, with very round heads. And in those cases, those sperm can't fertilize an egg naturally.
And are they able to use assisted reproductive technology to do it?
Typically, it's ICSI, which is when they take the sperm cell and inject it directly into the egg.
So what's the percentage of people that have these genetic factors? If we're saying 50% of infertility is due to male factor infertility, I mean, what's the percentage of that?
These are very, very rare, less than 5%.
So there's this huge portion of men who have problems having a baby, and we don't know why.
We have no idea. Our best chance of actually figuring out what is wrong with these patients is just looking at the semen quality and semen analysis. And those are pretty crude if you think about it. When we look at a semen sample, we only look, are the sperm moving? Are they moving normally? What do they look like? We have no actual root cause of that.
And let's break this down a little bit. When you say looking at it or semen analysis, you're talking about a man ejaculating and then looking at that under a microscope, and it's the clinician, the doctor, the laboratorian analyzing how quickly they move and how many there are.
Yeah, typically what we would do is the man will ejaculate either at home or in the clinic, and you'll bring it into the center, and the andrologist will have a look at his sample under the microscope, and like I said, we'll just look at whether the sperm are moving or not. Another procedure that will happen is they will look at his morphology, see whether does he have globospermia.
And when you say morphology, tell me that means how it looks or its shape?
That's how it looks, what it looks like, what the head looks like, what the tail looks like.
Okay, and so seeing if it's different. So in the US, and I think similarly in the UK, people can get a semen analysis by going to a doctor and getting a referral. In the US, sometimes this is covered by your insurance, and sometimes there's an out-of-pocket cost of a couple $100s. And some couples where the man has HIV, and they're trying to decide about what method to go about to get pregnant, this can become super helpful for them. And we've been curious about, we're always looking for DIY approaches and ways to make it less expensive. Is it feasible for a couple to ask their provider to look under the microscope that's just at a general doctor's office and see not the expert opinion that you would get from an andrologist? But just looking, are there some swimmers in there? I mean, how many?
Yeah, I mean, you would ideally like to go to an andrologist. They will give you the best diagnosis for that. I don't think you can go to your primary care advisor and do that, but you can definitely get a referral.
So get a referral.
Yeah.
Okay. And then other things we talked about, or we wanted to talk about, would be, how do STIs, so sexually transmitted infections, being former sexually transmitted infections or current, impact male fertility?
Yeah, so the common one is chlamydia. Chlamydia causes inflammation of the tubes that allow sperm to get out of the male body and can also affect female fertility. And once you have that, you can get a blockage of that, and that can severely affect your fertility. You can also get swelling of the testes as well that can affect your fertility.
And is that true after chlamydia is treated? Are those conditions that stay with you, or once it's treated, do those go away?
So if you get treated very quickly, typically you won't have the severe causes of that. It's when you have prolonged and chronic infection of chlamydia that this happens. I mean, obviously one of the problems with chlamydia is it doesn't have any side
I was just going to say, and so many people just don't know.
So it means you should get tested quite regularly.
Because you may not otherwise know unless you get the test.
Exactly.
And then what are things that men can do to increase their fertility?
So there isn't anything a man can do. Typically, there's not a pill a man can take to increase his fertility. Just general healthy lifestyle, and yeah.
But that's not. Yeah, that makes
I know.
me sad.
I'm sorry, but that's true.
Because I wanted to know that you could do, exercise or eating well or thing.
I mean, just general health will improve your overall being.
All right. Thank you. This is very helpful.